My name is Sue Vovchuk, and I'm the Executive Director of the Long-Term and Continuing Care Association of Manitoba. I have spent my entire career, over 30 years, working with seniors in Manitoba, both in frontline and leadership positions. I have an in-depth working knowledge of public housing, home care, and the long-term care sector. The Safety Den is one of the newest additions to our annual conference, first introduced in 2023 and featured again in 2024. This exciting program highlights outstanding workplace safety initiatives and innovative solutions developed by the long-term care sector. Ron Van Dennaker is the Executive Director of the Manitoba Association of Safety and Healthcare. With support from the healthcare industry and the Workers' Compensation Board, Ron led the proof of concept process and eventually achieved approval from all stakeholders to proceed and build an all-of-industry safety program for Manitoba. Mr. Van Dennaker has a master's degree in healthcare administration and related professional development within the healthcare field, coupled with 30-plus years of healthcare management. His extensive experience in both acute care and community health related services, and his intimate insight into many current health system issues. Good morning, Ron, and thank you for the privilege of speaking with you today, specific to the Safety Den.
Well, good morning, Sue. It's a pleasure to be here. I'm happy to talk about a very, very fun yet important initiative for sure.
Perfect. So I have a few questions, Ron, just to promote this event for our conference. Can you begin by telling us a bit about the Manitoba Association for Safety and Healthcare, better known as MASH, of Workers' Compensation Board of Manitoba, and the work you do?
Sure, absolutely, Sue. So MASH is actually a standalone, not-for-profit organization or a safety association that's funded indirectly by the healthcare system via a levy that the WCB collects on top of the premiums that they collect, and then that funding flows through to us.
So when you were developing this program, Ron, what motivated you? Is this a kind of a second part of this question?
Well, I mean, as you indicated earlier, Sue, I've been in healthcare for, well, I mean, how many years? 40 plus years as a frontline worker. I've worked in middle management, senior management, and obviously at the end, I became a CEO of one of the health regions. And one of the areas that needed a significant focus is on injury prevention. We focus a lot on bringing injured workers back into the workforce. But if we can avoid those injuries in the first place, then I think we're in a much better position, particularly now, given the fact that the healthcare system, not only in Manitoba but abroad, is short-staffed. And so every time we have injured workers, we're losing valuable time to care for the people, whether it's residents, clients, patients, whatever. So it's been a personal thing for me when I retired from healthcare to want to work with the WCB and Safe Work Manitoba to create something like this. And I'm very, very pleased to tell you that effective July 22nd of 2020, we became incorporated. And yeah, been doing quite a bit of work since then already.
That's so exciting. I know it's a passion project for yourself, and I've learned so much working with you. So, what specifically, Ron, is the role of MASH in supporting and promoting the safety culture in the long-term care sector? And how does the Safety Den event fit into that mission?
Yeah, so first of all, I think it's important to understand that injury prevention efforts, what we do at MASH is we actually provide consultation, training, and we are a certifying body. So once the safety management system of the organization is of a particular maturity, then the organization gets a certification standing. And with that comes a prevention rebate on the WCB premiums. But more importantly, it means that your safety management system and your culture of safety is more mature, and as a result, should effectively help you achieve lower injury rates. it's and regardless of whether or not you're working in long-term care or the acute care sector or whatnot, there are three basic types of injuries. There's the physical injuries, there's the violence-related injuries, and then there are those that are of the psychological nature, and that is the tsunami that we are really looking to address. Injuries in the long-term care sector are similar to those found throughout healthcare in general. However, Sue, it's well understood that staffing ratios
Mhm.
in long-term care have not kept up with the increased acuity, and therefore there is increased physical and psychological
Mhm.
demand on that particular workforce. And as a result, there has to be greater emphasis on health and wellness awareness in the workplace so that people can take the necessary steps to avoid the injuries, regardless of type in the first place. So it's imperative to involve workers as it fosters a positive safety culture. Employees feel more motivated, which
Mhm.
is proven to lower incident and injury rates across the system. Another real key difference, Sue, in long-term care from our experience is a lack of overall occupational safety and health human resources to support
Mhm.
the sector. You know, like although there are lots of really phenomenal OSH resources across healthcare, they historically focus more on the acute care sectors, given their limited numbers and demand in that area. So, with that being said, we at MASH, we think we offer an important opportunity to potentially fill in some of the gaps as the overall healthcare system moves toward a more overall robust workforce, filling in those gaps. And then, of course, with respect to the safety den, what that does, in a fun kind of way, but in an incredibly important way, is it provides teams across the system with an opportunity to develop innovative strategies and processes to enhance their organization's overall safety management system to keep staff healthy so they can do what they
Right.
want to do best, right? Which is,
Right.
of course, to care for residents and their colleagues as well. So it's very important.
Ron, you mentioned OSH. Can you just explain what OSH is for those people that aren't familiar with the acronym?
Sure. So OSHA is occupational, basically occupational, what does that
Envir
stand for?
Occupational
Environment.
environmental
Yeah.
safety and health, isn't it?
Yeah. You know what? OSHA is actually a WRHA term. Let me just say occupational safety and health professionals.
Perfect. Perfect.
And those
Perfect.
are the people that are prevention specialists. They're people that
Hmm.
work in the system to help workers stay safe.
For sure, for sure. Listening to you speak, I mean, prevention is where we want to put a lot of time as well, right? So, I mean, like you talked about the financial incentives for workplaces to become MASH certified, but I mean, having a safer work culture that benefits our patients, our residents, all the rest. It's a win-win for everyone. Would you agree?
Oh, 100%. I mean, when I referenced the prevention rebate of 15% off a premium, so
Hmm.
that is a drop in the bucket.
Yeah,
The way the rate structure is set up, it's based on your performance, and what we mean by
right.
performance is how many injuries. If we can reduce those injuries, what your the indirect benefit are things like reducing overtime, reducing the
Hmm.
reliance on agency staff,
Hmm.
and dropping the overall rates so that the industry rates drop so everyone benefits from a lower premium. What this does, it actually gives the system an opportunity to invest staff into areas were investments necessary. What we've been advocating for here at MASH is that with your prevention rebate dollars, consider reinvesting some of those dollars into those occupational health and safety
Hmm.
resources so that not only can you maintain your certification and a good safety management system, but you can continue to enhance it over time because
Hmm.
the sky is the limit in terms of how much money can be saved.
Sure.
One of the biggest arguments, Sue, when we were going forward to get approval to proceed with the establishment of MASH, was that In 2021, there was the equivalent of 500 FTEs off injured for an entire year. That's an incredible amount of
Staggering.
work, staggering, and not only in terms of cost, but these people are home injured. And when you're home injured, uh, it's still impacting your mental health. It's impacting your family life,
Yeah.
your work-life balance. So getting ahead of injuries in the first place, I think, is really the key to success here.
Hmm.
And in the very early days, Sue, we're only, what, January 2025 right now. We're already starting to see some fairly significant reductions in injury rates with those organizations that have already been safety certified. And again, we have a particular passion for the long-term care sector
Hmm.
because we know that there are gaps in that area. And if there are some things we can do to help move that along, that's exactly what we need to be doing.
For sure. And so many of the best ideas, as always, come from the frontline staff and people that are living and working day to day in the heat of the moments. Ron, so you touched on this a little bit. Why is it so critical to continue focusing on safety and long-term care, especially in the current healthcare landscape? You talked about, the number of injuries is, it's increasing in some respects. The risks to workers are increasing, and it's important to keep our staff healthy, to provide great environments for our patients and our residents. So, in a nutshell, then, why do you think it's so critical to continue to focus on safety in healthcare?
Well, I'll tell you my experience. I mean, I've always been impressed with healthcare workers because healthcare workers go into this world not for the money. They go in because they have a passion.
Hmm.
But there is a whole different level of passion when it comes to people who want to care for seniors in personal care environments and in other environments. And
Hmm.
so, again, with the resource challenges and the passion that people have, we need to make sure that people that have chosen this career can continue to focus on the passion and not have to deal with a lot of the other potential issues that can get
Hmm.
in the way of what they want to do. Because really,
Hmm.
at the end of the day, who benefits? And it is
Hmm.
the residents, the
Yeah.
families, and the communities. The people in long-term care, they are at that particular point in their life. They deserve good quality care and happy care,
Yeah.
and care from people that enjoy doing what they're doing. And that's really hard to do when you're getting hurt at work,
Yeah.
because we know that healthcare workers are heroes. And
Hmm.
so we know that when somebody's falling, the it don't lunge and put yourself at risk and let that
Hmm.
happen and then deal with it. Well, hard to do when you're a
Yeah.
healthcare worker. And
Hmm.
so it's training and reinforcing the importance that that might be something that you feel you need to do now, but in the
Hmm.
long run, doing it the right way will provide a lot more benefit over a longer period of time, and you're not hurting yourself. So yeah, I mean, we need to help in everywhere across the system,
Hmm.
but this is an area where I think we can really make a difference. And the safety den is a wonderful opportunity.
Yeah.
To your point, which you said earlier, is just no question. I mean, the ideas,
Yeah.
the talent is at the front line. We all know that. Those
Hmm.
of you that have been there,
Hmm.
I'm looking at you and me. We know what ideas we had at the front
Hmm.
line too, and it's important to harvest that as much as we can.
For sure. And you said, I mean, you talk about, long-term care and the workers. I mean, you talk about a passion. I've had the privilege of working alongside so many people. I call it almost, it's a calling, really, to work with the older adults in Manitoba for sure.
Yeah.
So you touched on this a bit. So, I mean, I think we think about the safety den and the submissions. I think we overcomplicate what these ideas need to look like. I mean, the ideas can be quite simple in nature and have huge impact. I know at our 2023 conference, I mean, one of the winners was from actually Margaret St. Vital, and they were doing stretching exercises before their shifts to try to reduce the number of musculoskeletal injuries. So, I mean, I don't want people to think it's onerous to make a submission to the Safety Den for us to showcase at our conference. It doesn't have to be. So you touched on this a little bit, Ron, kind of ending this conversation of how the Safety Den can support workplace, safety. And, looking at the innovations that are happening as well within our commercial memberships, it's phenomenal with some of the products and services that are also being developed, inspire us with safety, correct?
Yeah. Yeah, you're 100%. It is a team effort. I mean, whether
Mm-hmm.
it's frontline workers or our vendor industry that
Mm-hmm.
supports us, government and whatnot. What's really cool is that even though there are nuances and things that are unique to various different workplaces, whether it's a physical environment or culturally or whatever it is, there's always going to be some commonality. And I think where this could go is that as we start to develop an inventory of best practice that's
Mm-hmm.
evidence-based, that demonstrates that we're moving the needle in this direction, it's important that we share that we go from place to place, that we talk about the experiences and the benefits, and try to have other people adopt those, modify them, if you will, and
Mm-hmm.
just keep moving in this space, because it's not a space where we've done particularly well at. We're
Mm-hmm.
better when it comes to patient safety. That is, of course, what everybody talks about. But Sue, you've heard me say this before. You cannot have good quality, safe patient care with high satisfaction grades if you don't have a happy and healthy and safe
Yeah.
workforce. They go hand in hand.
Yeah.
They're mutually together.
Yeah, I agree 100%. I said, I mean, you've taught me so much over the last couple of years working with you, for our conference, and it's such an opportunity to highlight the tremendous work that's been done in the long-term care sector in Manitoba already. So just to end, so the Safety Den is one of the newest additions to our annual conference. We said it was first introduced in 2023, and we featured it again in 2024. And this program, does highlight our workplace safety initiatives and solutions developed by this sector. So as we look forward as a sector, we want to expand the impact of this safety den and encourage more submissions to showcase the incredible work that's already been done to enhance safety in our industry. We want to inspire and motivate participants, just like you mentioned, Ron. We want to learn from one another. We want to celebrate one another. We want to hear from you. We are listening. This is an incredible opportunity and venue to celebrate all those ideas and innovations, passions, calling, whatever you want to, however you want to frame it. It's
Yeah.
amazing work. So we want to continue to grow this event, and we want to have more and more submissions coming in for our Safety Den. So please take this opportunity to celebrate the work you're doing, to celebrate your calling, your passion. We want to hear from you and celebrate you. Please visit our website at www.litcam.mb.ca/safety-den. But if at any time you have any questions, please feel free to reach out to us at 204-477-9888. And again, Ron, I can't thank you enough for your time, your energy, your passion, and your vision, and the privilege of working with you on this incredible work. Thank you so much.
You're very welcome, Sue, anytime.